Thank you, Professor. It's my pleasure to be here, and I want to share some of my knowledge about the AI application in stroke, which is now widely applied. As you know, that's one of us will have a stroke in our lifetime, and we don't want to be that one. So it's very needed to be prevented from this. And as you see, the stroke burden in the world is very severe, and Vietnam is one of the most severe in the Southeast Asia. And when you see the numbers, when we compare to Thailand or Singapore, Vietnam has the highest rate of the ASEC standardized mortality and incident. So the stroke impact every patient and every day. But in Vietnam, we are normally running into the overload situation because running out the beds, especially in the central hospital, because less patients want to stay in the province hospital. And when you see here, we have the number in 2021, that's a comprehensive stroke center in Vietnam, just only 6, and now it's improved to 14 or 15. And here is the sum of the quality assessment by ANZO and WSO. And now we improve so many comprehensive stroke center. And all of us know that the AI application is now widely applied in the world, and we also know that the time is brain, so we want everything running very fast, and the AI will help us a lot. And here is the AI. As we all know, the AI is a study and design of intelligent agents, and it will help us to make a system that perceives its environment and take action that maximizes chance of success. And here is the introduction about the AI and deep learning that all of you will know. And here is an article that we will know that's the role of AI. And the AI in stroke will help us in the automation of the imaging interpretation and the clinical assessment. It will help us to evaluate the NCCT, the aspect scoring, to identify the CTA and even the CTP just only in a few minutes, and we will have us to make the treatment decision. And based on this, we will have the treatment recommendation, and we can have the predict of the outcome. So the role of the AI in the stroke case, we will have the primary prevention, acute stroke diagnosis, the treatment, the rehabilitation, and the secondary prevention. It will help us to answer so many questions here in just a few minutes. For the intracranial hemorrhage stroke, it will help us to identify the bleeding lesions. And you can see here is very clearly to see the hemorrhagic lesions in the right cerebral hemisphere. And in the software, it can also help us to calculate the volume of the lesion also. In the stroke, we have the multimodal imaging. We will have to aspect score, the LVO detection, and the perfusion map. It's been very fast and reliability. So many AI software you can know that's the rapid. We have the Brainomics, we have the Vis AI. And here is the screenshots of the rapid AI. And here is the function of all the AI software that you see. That's the most popular is the rapid AI, which have us in launching to see all the results in the CTP and MRP. AI will help us in giving advice in how to measure the lesion in NCCT, especially the aspect score. As you know, the aspect score, if you are not the expertise, you can miscalculate. Sometimes it's objective, sometimes it's objective. You can say it's 7, some doctor can say just only 5 or 6, so it will affect to your treatment decision. Here is the image. If just looking very briefly, you can say just 7, but when you change into the stroke window, you can see just only aspect of 5, so very high risk of hemorrhage. And here is some software you can see in the Brainomics, or here is the rapid AI. It will have you just only in a few seconds after the scan. Here you can have the score of S, and you can see the ICA is occluded, so the treatment decision is very clear. We have the patient that is 5th hour admission, NIA stroke score is 13, and we have the different results. If we train the software based on the criteria of the rapid. Here is the image, and you see it's no indication. But if you use the CMN software on the machine, you see the different result. So what is your decision? You treat or not treat this patient? So it is the reason that we need the standardized software, and you see that's when we compare the rapid AI had the best predicted hypoperfusion. And we have some case we apply in our hospital. When you see the result here, the core is 44 and the penumbra is more than 177, so this is the indication for the treatment. Another case, the aspect score is 6 and the left ICA is occluded, and here is the map of the rapid. You see a bit artifact, but the mapping of the arterial and the venous phase is good. So the rapid will want you to review the sources data to avoid misunderstanding. And here is the map. And based on the map, it went through. This patient have the onset very early, just only within the 90 minutes. So normally we need to through the CBF less than 20%, not the CBF less than 30%, because within the 90 minutes, this is a recommendation. So the core here is 54 ml. And the patient have the bad collateral because the hypoperfusion index is 0.5. And in this case, we indicate for the mechanical thrombectomy, but we know it is a high risk of the hemorrhagic transition. So with the AIs, we can have to predict the LVO, the vessel, on even the NCCT. In here, you can see this is a meeting application. This can have us to detect the lesion and have us to identify where is the vessel is occluded just only based on the NCCT. Very nice here, and you can see that some of the image of the meeting is from the Barcelona. With the deep learning, it can have us to identify the last vessel occlusion on non-contrast computer tomography, no need for CTA. And for the next year, we will have the done simple, maybe we're launching in Vietnam also. And overall, we know the radiomix is very widely application in the brain tumor. But the radiomix is also applied, is identify the clot in the brain. You can see here. Here is the class-based radiomix predict a mechanical thrombectomy strategy. Even the AI can have us to see where is the class and have us to how many number of passes it will predict, how many number of passes we will have to do in this case, and it will launching us for the strategy. Here is recommend to do the direct aspiration first because it can see the component of the blood clot. Here we see how the AI will analyze everything of the clot, and it can have us to differentiate the embolize with the thrombus, which means the white the white blood clots with the red one. And another application of AI in stroke, thus we can see how tortoise of the vessel, because it's been concerning, it's been affect our way to approach or our system to support when we do the procedure. When you see that so many curves, especially in the older patient, so if you want to access to the left ICA, the left M1 for the thrombectomy procedure, which way is the best way? Here is the software of the AI. It will have us to calculate. Normally, we will go via the femoral puncture and we go to the aortic arch. But if you go there, there is a tortoise here, and you go there. So it's very tortoise, and sometimes you get fail. So in another ways, it will have us to calculate everything. You can go like this, but you can simply do through this way by go through the bronchial or the radial artery. Everything can be calculated by the AI. Because if you have the prediction first, you can through this way from the firstly, and your procedure can be complete very fast. But if you through the femoral to go first, you will struggle through this way, and you can fail maybe 1 or 2 hours, and then you switch to the bronchial artery. So it's not time, it's brain. So in the application, we're looking to have this one. For example, in this case, the software will tell you. If you have to do the thrombectomy in the right ICA, it will recommend you to go via the femoral puncture. But if you need to go via the left ICA, it will recommend you go directly to the brachial artery or the radial artery. Another trials will have the sensor in the microwire to identify the component of the clot. For example, it will have us to identify which is the white or the red thrombus. We know that the red thrombus is very easily in doing the aspiration. Here is some trials. And of course, with the AI application, it will have us to do everything quickly. As you know, that now we extend our indication from the stroke thrombectomy to the large core infarction, even with the aspect from the 0 to 5. And we extend our time window beyond the 6 hours. Another application is the AI in the stroke system. Normally, we also have the question, when the patient has the stroke, which hospital will you go to transfer? You will transfer the patient to the closest hospital which can do the IV RTPA first, or you will transfer the patient directly to the comprehensive stroke center, which can do the both IV RTPA and thrombectomy. So here is the trial in the European, the race cast. You have the stroke here, you transfer the patient to IV RTPA first, and then you move to the comprehensive stroke center, or you go directly to the comprehensive stroke center. So they based on 4 factors. The first one is the distance, the second one is the time from onset, the third one is the age, and the fourth is the NIH stroke scale. When the patient has the stroke, they will have all the information gathered here, and the machines will have to calculate which option is better. Option A, this means IV RTPA first and then thrombectomy. Option B, go directly to the comprehensive stroke center. And you can see here with the outcome, with the model of the race cast, it will have first to choose the right way. It will improve the results as we will have more patients have the good clinical outcome and less patients suffer from the mortality. And especially in many European countries, they now have the AI-based platform or application in the smartphone, which has the clinical doctor to manage everything. You can see here, I can go very quick. This means that when the patient has the stroke or has any symptom, they can consult with their clinical doctor for the treatment. And if there is any suspected of the stroke, the AI will tell you. Is this any LVOs or non-LVOs? It's based on all the symptoms and all the image, just only on the smartphone. But it's not available now in Vietnam. But we are really looking that we will have it soon. So in conclusion, you can see that AI has great potential in stroke care, including first supporting neuroimaging diagnosis, have the clinical decision, reducing time from door to needle or door to puncture, and we'll have the clinical doctor to monitor and outcome evaluation. But it does not replace the clinical. So we will have it like we have the very good resident or very good college to have us to make everything faster. And we're really looking for smart Vietnamese stroke software. Thank you.
Thank you very much for Dr. Nguyễn Quang Anh to give us about the overview of AI application in the stroke system and for diagnosis and for the management and for the treatment. So do you have any question or comment from the audience, please?